Dr. Meeta Aaron. I am a fertility specialist at Ziva Fertility, Noida. In my previous video, I have mentioned about the terms TISA, PISA, TESI and micro TESI. The link of that video we will be providing you, and today we are going to discuss about these terms and these procedures. So first we will know why these procedures are required and how it is done and what are these procedures. So first of all, I'll tell you the terms which I have just mentioned. I have one is PISA, TISA, TESI and micro TESI. So PISA is percutaneous epididymal sperm aspiration. Then TISA is testicular sperm aspiration. Then TESI is TESE, that is testicular sperm extraction. And fourth is micro TESI, that is microsurgical sperm extraction. These techniques are sperm retrieval techniques which are done for IVF procedure if the male partner is having a problem of azoospermia. So azoospermia is the problem in which if a infertile couple is having a male factor infertility and the male partner gives the semen sample for testing and there we could not find any sperms in the semen sample. So that problem is known as azoospermia. So this first we'll understand what is azoospermia. So azoospermia can be because of many reasons, and the major causes of azoospermia are either it can be a obstructive reason or it can be a non-obstructive reason. The obstructive reasons for azoospermia can be any problem which is there which blocks the outflow tract of sperm from testes to the outside. So it can be because of any surgical procedure like vasectomy, or it can be because of some trauma to the area, or it can be because of cystic fibrosis and some other causes. This is known as obstructive zoospermia, in which the sperms are there in the testes and epididymis, but they are not able to come outside. So this is obstructive azoospermia. Then another form is non-obstructive azoospermia. In this there is a problem in the production of sperms. Sometimes there is improper production of sperms. There is not optimal, so they are not able to come out, and there is some abnormal formation of sperms. So immature forms of sperms are formed in the testes and they are not able to get excreted in the semen. So it can be because of genetic causes, or it can be because of certain testicular failure, or some varicocele. In these causes, the testes are not able to make the proper sperms and excrete to the into the semen. So these are the method of diagnosis, whether the patient is having obstructive or non-obstructive azoospermia is: one is the semen sample collection, in which we can see whether sperms are there or not, and there are certain blood markers which can be done. That means blood test can be done which shows that there can be some problem in the testicular in the sperm formation. So once the diagnosis is made that the male partner is having this problem, then we can decide further that which procedure we need to do. Now once the semen sample is not having sperms, we can try to take out the sperms directly either from the testes, or if there is a obstructive zoospermia, from the epididymis. That is, epididymis is a part of the reproductive organ which is attached to the side of the testicles. So in cases of obstructive azoospermias, the sperms are there in the epididymis but they are not able to come out. Now this is the reason. These are the reasons of azoospermia. Now coming to the procedures, first is PISA, that is percutaneous epididymal sperm aspiration. This is the procedure in which we are taking out sperms from the epididymis. We are just putting a needle into the epididymis and then we are aspirating the sperms from that. This procedure can be done in local anesthesia as well as general anesthesia. It is a very simple procedure. It is a daycare procedure and it is not associated with too much of pain. Majority of cases with obstructive azoospermia, we retrieve the sperms and we get a good success rate. Sometimes if we are not able to retrieve sperms by PISA, then we go ahead with the next procedure, that is TISA. This is